we are going to talk about EMDR and how that relates to emotional abuse recovery. So we're just gonna jump right into it with Leanne. So could you talk to me a little bit about how EMDR might differ from working with someone who's a victim versus someone who's an abuser? And Lynette, Dr. Hunt, Charmin, Dr. Hawkins, we definitely want to hear your input because you work extensively with these type of clientele. So actually, let's start with Dr. Hawkins because I'm curious. How would you think EMDR would be helpful for your clientele, mostly the abusers? And what traits do you see in your work that would be a marker for you to recommend them to EMDR?
Well, I mean, an emotional abuser, a narcissistic abuser, I think of it as a responsibility deficit disorder, which there isn't such a thing truly, but these men are so defensive, and working with them, I feel their defenses, I feel them. So it'd be very interesting to me. You're gonna have to tell me actually, Leanne, how EMDR could help them, but they're so guarded, so self-protective, and they're so rigid in their thinking. And I want them to be more fluid in their thinking. I want them to take ownership for their abusive traits, which they have many. They diminish their partners, they defend against their partners, they overwhelm their partners, they dominate their partners. And so, but it is a responsibility deficit disorder. They're not taking responsibility for their actions, and so they don't change. And so their partners are narcissistically abused, emotionally abused. So, I mean, we know the victims need EMDR. I'm not positive how EMDR can help me work with a man to challenge him to be able to sit in therapy, which is a big deal, to tolerate my confrontation, which is a big deal, and then to begin to own some of their issues, and then own more and more and more, hopefully, if their partner, which is often the case, they often choose to stay with these men. And so I'm working with both of them sometimes, but you tell me, how can EMDR help me to challenge this man to be able to sit with his own grief, his own early trauma, and then be in a place where he is able to utilize counseling and then grow and change.
And that's really the key. What you're saying is for the man to be able to, or the abuser to be able to utilize counseling.
That's it.
Because we're offering them, like as a center, we're offering them great counseling.
Yep.
But they can't utilize it.
They walk in the door and their first words really are, I don't need to be here.
Right.
I don't need this. Or, my back's against the wall. She has threatened to leave me. So I will come and I will be receptive. Not.
Right.
I will grow. Not. I will change. Not. I will think differently. Not. Not.
Yeah.
While they're saying, of course, Dr. Hawkins.
Yes.
Of course.
Yes.
Count on me.
Right.
Not so much.
And do you find that with the folks that you're working with, are they admitting to having early childhood experiences in which owning? Okay.
No, they'll give a broad brush stroke. They'll say, I wasn't raised in the best of environments. My dad was a typical such and such, and but hey, look, I turned out okay, didn't I? Not so much. Not so much. No.
Yeah.
And I got to be able to say that,
Right.
not so much in a way where but that's my work, to build rapport.
Yeah.
But I would love to have your help
Yes.
in having them be more fluid in their thinking, to have more insight. What Dr. Hunt, we talked about someone being psychologically minded and being able to utilize counseling. These guys, not so much.
Yeah. And I would wonder about folks that are saying, oh, my childhood wasn't so great, but it has no impact on me and I'm great.
Exactly right. That's what I hear.
It's like I don't know, it seems like there's a fear of lots of different things, and we're seeing it as aggression, and their partners are seeing it as aggression. But if we could start seeing it as fear, and even if the abuser can start seeing it as a fear, and where did that fear come from? Because EMDR is great about what you can do with EMDR is have them experience an emotion or a body sensation if they're willing to do it, and then float back to an earlier time when they felt that same fear. And oftentimes your mind will go back and get the first experience or the most pertinent experience. And if they're willing to work on some of those earlier memories that shape them into a person who fights when they feel fear.
I don't mean to be difficult, and I
Mm-hmm.
may be coming across a
It's okay.
little difficult-y right now, but I'm thinking the guys I'm working with would say, I don't have fear.
Mm-hmm. Yeah.
I don't have fear.
Yeah. And do they have anger? Maybe we
Oh,
can
they have
bridge-
anger.
Yeah.
They have anger. They'll, well, I mean, you know, because she pokes at me, she pushes me,
Mhm.
she does this, she does that, she does this, she does that.
Mhm.
So it's not really my anger, it's she's causing this.
it.
Anyway, back to the fear.
Yeah.
So can you work with a guy who's saying I don't do fear?
Mhm.
I'm
I
pretty
think
confident.
I think I would probably go into, okay, what do you feel? You feel anger, you feel frustration.
Frustration. That's
Yeah.
what that's the one they grab a hold of. I
Yeah.
feel. In fact, I'm not even sure they would say they feel anger. It's frustration.
Yeah. Because frustration feels very powerful, and you can do something, like you can problem solve with that. But most of the time, anger is like a secondary emotion to a more primary emotion, which would be
Yeah.
guilt or inferiority, fear, trauma.
So you said something in the first video that
Mhm.
makes me think about what you just said, right?
Okay.
So you've got a guy that's angry or frustrated.
Frustrated.
Okay, we'll go with frustrated. And so you mentioned earlier
Mm-hmm.
that you also can work on specific thoughts,
Mm-hmm.
right, or beliefs,
Yeah.
right? So when I see men, sometimes the conversation I have inside of that is about specific thoughts they have when frustrated or when angry, sometimes around the issue of what permissions do they give themselves
Oh.
to respond out of their frustration in a certain way toward her.
Yeah.
So, for example, what is it that you believe that makes you think it's okay to call her that name,
Yeah.
to show up that way?
Mhm.
But even past permissions, just when you're frustrated, what specifically do you think? Like, what's the, and so I'm wondering, can you, like, if we can identify what the thoughts are inside the feeling,
Yeah.
can you work with that?
Yeah, like and I would wonder too, just as to piggyback on that question that you're asking a person frustrated.
Mhm.
What do you believe is going to happen if you own responsibility? Like, it kind of gets them to think about, what is the fear there? Like, what's the worst case scenario if you say, gosh, I was wrong, and really own it?
Mm.
What's going to happen if you stop calling her names? What's going to happen? Like, what is the threat? If you let go of this behavior, what's going to happen for you?
Yeah, like if you don't demand your way, what
Yeah.
does that lead to?
What happens if you're more flexible?
Mm.
What's happened in the past when you tried to be more flexible or let someone else get their way? Sometimes maybe they were victimized. as a kid.
Again, I'm going to be a little difficult-y.
Just fine.
What if the guys they've normalized their actions?
And they have.
And they have. See, you're
Yeah,
saying,
absolutely.
well, what kind of thoughts do you have that give you permission to call her that name? I think the guys I'm working with would say, well, yeah, I probably shouldn't call her that name, and it probably is not the best.
Well,
But
okay.
she uses some bad language too.
Well,
So
but we also have data, right, that they don't treat everybody this way,
we do.
right? So they're able to go out in the world and not call people those names.
Yeah,
right?
but she did. I mean, come
Well,
on.
and that's the question. So in the she did, is there a belief that if someone treats me this way, I have full license then to unleash
Yeah.
like my inner beast?
And
Yeah,
then
yeah.
how come they don't use that full license with other people?
Right, what's the
Yeah.
restraint that they're able to use
Yeah.
out in the world that they don't
Exactly.
use it?
So is EMDR? Back to your question? Is EMDR able to do something with that to increase? Well, you can't increase insight, I don't imagine, but we're looking at ownership and insight and someone to be able to think about their thinking.
Thinking about the thinking is huge.
Yeah.
Yes.
And even just being able to be willing to not do the same patterns over and over again. Like I kind of see these patterns as a fear response that's more of a fight. Like we're going to fight, but we're going to do it in this little, this covert and backhanded way. We're still fighting. And it's like they approach each person that's trying to get them to hold some responsibility in a fighting kind of way.
Yeah.
So if we can get them to look at any fear or even any frustration or any anger and float back to an earlier time, then we can work on some past trauma that informs this current behavior. But the key is just willingness. How do we get them to be willing to not do the same fight over and over again every time they get triggered with that same fear, that same frustration? This script is like we're wiggling and maneuvering and wrangling, trying to get them not to do the same behaviors with us, with their wives, with their
And
children.
they've been doing these things for so many
With
years.
success.
The
It
ruts,
works in the
the ruts in the road are
Yeah.
very, very deep. Like a truck that's driving down the highway. The truck isn't driving down the highway. It's in the ruts that are on the highway. And
Yeah. And that behavior works in customer service. You get your way. It works in the workplace. You get ahead. So it's really hard for it, not to be reinforced over and over again.
Well, and I guess that's part of the question, right? Like, because you see men too, you and I both do, right?
Yeah.
So sometimes my question to them is, how satisfied are you with the way things are? And his answer is usually going to be much more satisfied than she is.
Right.
His dissatisfaction is mostly because she pokes him. Like
or she's
Right.
withdrawn.
Yes.
And
So he's usually happier, which leads me to then, what is it you, sir, really want out of a marriage? So if he's currently getting what he wants, if this is actually the marriage he had in mind, if this level of control is his goal, we have a
What's in
problem.
it for him?
Yeah.
Yeah.
Exactly.
Yeah, what's in it to him to change?
Right. Yeah.
Well, then, explain this to me then, because I'm hearing two things. These men need the EMDR to be able to process these feelings,
Yeah.
but they also are stuck with work with Dr. Hawkins because they can't process their feelings. So then, which comes first? Do they need to work with someone like Dr. Hawkins to explain what's going on so they are willing to go to EMDR, or do they go to EMDR first so that they can get the work done and have success with someone who works with?
I think we're going to say these complement each other, but I'm very curious as
Maybe
to.
we pass back and forth.
I think we toggle back and
Yeah.
forth because I'm looking at the defenses they use:
Yeah.
justification, minimization, rationalization, excuse making, blaming the victim, all the different
Deflecting.
mechanisms they use to avoid taking responsibility. But I'm thinking EMDR is going to help create a more fluid way for them to access their feelings and their thinking about their thinking. I don't know what.
I think-
Tell us. What do you think? It's a complementary talk therapy and EMDR with.
And I would say, like, have you ever seen someone like in a window of healing where they're just in a good place to actually do some introspection and look at themselves?
Yeah.
Like some of the men that you work with.
Yeah.
Maybe send them to me right then. And then, like,
Hotline.
We'll hop on that window and see if we can make some progress during it, knowing that it might pass, and then I need to pass them back to you. But sometimes people, like, let's say they lose their job. Something becomes painful. Something becomes out of their control. They're used to controlling their whole environment, and something becomes out of their control. A kid says, "I'm not talking to you anymore." A spouse says, "I'm leaving," and moves out. Sometimes they're in
That
pain.
one.
Yeah.
That one.
Sometimes all of a sudden, a
That's
person's
the
in
one.
pain, and they're
Yes.
like, "Okay, I'm ready to work." It hurts. It actually hurts.
After he
Let's
becomes really frustrated. But
Yeah.
I'm with you.
Yeah, but I think sometimes maybe we can find that window of healing and jump on trauma work during that time instead of trying to push them when it's just going to be like beating their head against the wall and
Yeah.
wrangling,
Yeah.
So EMDR is probably not going to be the most effective if someone is still very resistant to
Yeah,
going into those emotions, being vulnerable.
yeah. And I can certainly talk to them quite a bit about the benefits of it and what it looks like, and try to ease their fears. You know, like that's something that I think I'm really good at, is helping people get comfortable with doing this as a process. And sometimes people are willing to do EMDR therapy because it's not talk therapy. So they feel like it's a procedure. I'm going for a procedure, or I'm going for this treatment. And so sometimes they're more willing to do it because it's not the traditional therapy.
Their lives are not working.
Yeah.
They're not working. Now they're defending themselves. You know, they're not working because she fill in the blank.
Yeah.
But I agree with y'all that we can talk to them about your life really isn't. Come on, let's and you can talk on that level. Look, I'm imagining, by the way, you coming to one of our men's groups or something and just sort of look. I know y'all don't like going to the dentist. You don't like going to the doctor. You don't like, and you don't like going for therapy. But but we need to go to the doctor. We need to go to the dentist, and we need to go to therapy. And I'm imagining that you could really help them to see the value of EMDR.
Yeah, I think so. And if they could see that even just desensitizing some of the reactions that they have and the feelings that they have of rage, like even if they could say, okay, I want to work on rage, and we could get that feeling down to a manageable level, perhaps they could use some of the skills that you guys are teaching them. Like you're trying to teach them these skills, but if they're feeling this level of rage at like an 8 or 9, then they feel like they have to fight. Their body's driving them toward that same fight that they do over and over again.
I'm thinking of some of the guys, we can't use names of course, but right below the frustration and the rage, you know they're sad as all get out. I mean, you know, their partner has left them emotionally, their partner's left them physically, sexually. I mean, it's devoid of any intimacy, any intimacy. So I'm thinking EMDR could help kind of lift the rage, frustration lid. Is that true?
Yeah.
That it could lift that lid, help them access their pain. And by the way, these women, not to go on another tangent, but they want to see that godly sorrow, which they don't see because he's tough as nails. But underneath, if you lift the lid, can you lift the lid?
I could try.
And I'm wondering, so if I heard you correctly before, it sounds like your kind of normative experience with them is that the first thing they feel is resentment.
Oh, yeah. Oh,
Resentment that I have to be here.
absolutely.
Can you start with resentment?
Oh yeah, absolutely.
We can get those to you.
We can. They'll walk in the door with a lot of that.
Even if they could get that out of the way and feel willing to go without that, like that's just another defense that we're having to work past.
So we're going to be talking a little bit more about brain spotting, right? Brain spotting and safe place, is that correct? So keep an eye out for our future videos. Leanne's going to actually teach some of the members here on what those things are. If any of this resonates with you and you want to work with Leanne or with any of the clinicians here, please feel free to contact our website at marriagerecoverycenter.com, or you could also book a free client consult with a client care specialist for 20 minutes. You could do that by calling 206-219-0145. Thank you.